Hello, Dr. Brad Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Hi, and welcome to another episode of Ask the Chiropractor. Today's question was about cervical radiculitis, or just let's call it radiculitis as a whole, because some people call it radial radiculitis, brachial radiculitis, cervical radiculitis. Let's just say that there's an irritation of the nerve coming from the spine, because whichever one we're talking about, it's the same answer to the question. Can chiropractic help? The answer is yes. In many cases it can. So a patient was on Facebook and talking about trying to find someone, a chiropractor that could help with cervical radiculitis. I replied back that I'm a chiropractor. If you have questions, I'd be happy to answer for you. A patient came in, and the first question they asked me, which was backwards, is whether or not we take x-rays, because they wanted to make sure that we took x-rays. So the answer was yes, we take x-rays, and then we were able to help them out. It turns out this patient came to us because a neurologist told them they should go see a chiropractor for what's going on, not a neurosurgeon. Like backwards. How does chiropractic help with radiculitis? Basically what happens is there's what we call a subluxation. One or two bones in your neck will misalign. When they misalign, there's stress there. When that stress hits that nerve, and wherever that nerve then goes into fight and flight. And long time of that happening, the nerve starts to just run out of energy, run out of power, and it starts to have more and more issues going wherever it travels. So what we do as chiropractors is to determine whether or not you're a patient for cervical radiculitis, radial radiculitis, brachial radiculitis, whatever, radiculitis. We would do a couple exams on you. We'd want to first see how you move or don't move, or you have loss or range of motion in your neck, to see whether or not that's part of the problem. The next thing we would do is we would probably ask you, if you put your hand on top of your head, does it feel better? And try to get some other testing going on to see whether or not this is what's actually occurring. Next we would do is we would take some x-rays of you, and we would look for these misalignments. If we see these misalignments on x-rays, then we're probably favorable that we might be able to help. By adjusting the spine in that area, we help take the pressure off that area, remove the stress in that area, then allow the nerve to travel out and do well. Now, I've been in practice for 22 years, so when I first started practice, Syracuse University had done a study that showed that a lot of brachial surgeries were happening for carpal tunnel and stuff like that, and they were having really bad success with it. And Syracuse University showed that the majority of these cases, it was actually coming from the neck. So when it goes to even like carpal tunnel syndrome, a lot of times that goes away under chiropractic care too. Now, the only definitive test, or I shouldn't say the only definitive test, the best test that's currently available in the medical field to measure where this radiculitis is starting is basically an EMG, where they hook up a bunch of stuff to your arms and they measure the nerve impulse going up and down to try to figure out where it's being impaired. So if you were to go to a chiropractor and they x-rayed you and you don't have any misalignments in your neck, then I would think the next logical thing would be go to a pain management person and have an EMG done and see where this impingement is occurring. Then is it happening in your elbow? Is it happening in your wrist? Where exactly is this occurring? I feel like with this EMG testing that we're having less carpal tunnel surgeries than we did 20 years ago, because we're finding out it's not really coming from there, it's coming from other places. So you go to the chiropractor and they do all the testing. They just said, hey, you know what? You are having cervical radiculitis. It is coming from here. We do have a spot in your neck we can adjust. You go get adjusted. After a bit of a time period, you start to notice that heart's coming back. Now, the hard thing about the radiculitis is a lot of times the numbness and tingling, that can be one of the last things that come and one of the last things that go away. When you start getting adjusted, you might start your range of motions improved. You might be able to say, I can move my neck better, I'm sleeping better, I feel better, but I still have this tingling in my hand. That's not weird to have that tingling to continue to occur once you start feeling better, because like I said, it takes a long time for that to go away. It took a long time to get there too, ironically. That's usually one of the last symptoms that shows up when this is occurring. So how would I know if I'm a chiropractic patient if I had radiculitis? Maybe you had a previous neck injury, maybe you didn't. Maybe you just have a tightness going between your shoulder blades or an irritation. A lot of times people describe it like a knuckle on the inside trying to dig its way out. So if you're having this, how do we know if you're a chiropractic patient? Like I said, we would do the exam and we would do the x-rays. Now let's say I am a chiropractic patient, I get my care, I follow the care plan the chiropractor recommends, and the care plan the chiropractor recommends will be different based on your x-rays and your exam findings. Maybe you have a loss or curve, maybe you have a good curve in your neck for posture. That would influence your schedule. Maybe your spinuses are severely turned and rotated and the misalignment's really big. That's going to take more care than if you don't have it. There's nothing that says, okay, I have cervical radiculitis or radiculitis coming from my neck and it takes X number of visits. There is no X number. You can plan on 12. If you go back a couple episodes, we did a research paper that shows it takes at least 12 adjustments to make a change. So usually we'll take 12 adjustments to make a change, not to fix it, but to make a change. Some cases it fixes it, some cases, but you gotta give it 12 adjustments to know if it's gonna work or not. That research has been performed. So we do the 12 adjustments, now we know we're getting better, so now what does it take after I finish my care plan, after the chiropractor does my post checks, it says your range of motion is back, your hand strength is back, your tingling's gone, congratulations. Now what do we have to do to maintain this? The chiropractor should teach us some really good posture exercises, because a lot of times posture is huge with this. So the chiropractor will teach you some posture exercises and maybe some stretches if they see something they can help you with. Maybe some things to start avoiding. Hey, you really can't do this or this anymore because it's creating these problems. That's why you have to tell your chiropractor everything that you're involved in. Sometimes you might get some physical therapy involved. If it's been going on too long, you've got some muscle loss in your arm, a physical therapist can help us regain that strength. So it's going to be a case-by-case basis, but after 12 adjustments, you should start to notice, hey, this is working, I'm getting better. If after 12 adjustments you're not experiencing that, then it's worthwhile to go find a pain management and get that nerve test done up and down your arm to see maybe it's coming from your elbow or something else. Because it's possible two things could be true at once. You could have that misalignment in your neck, that subluxation in your neck, but you could also have an elbow impingement or something weird going on down there. So it's possible two things are happening at once. The chiropractor will help get your neck better and fix the problem in your neck. That way, when the nerve coming from your neck goes to your elbow, the physical therapist can work in your elbow and get your elbow feeling better. Now, I want to get the elbow, try to fix the elbow if the nerve up here from your neck isn't working, because when the nerve in your neck isn't working right, the nerve in your elbow isn't working right, and the potential of your elbow getting better before the nerve in your neck is better, it really doesn't work in your favor. So I would definitely work with the chiropractor first and then work with the physical therapist afterwards. And your chiropractor and your physical therapist should be able to communicate and talk to each other to get this done and work as a team for your... So there you have it. If you're having radiculitis coming from your cervical spine, chiropractor is a great place to start. Now, will your neurologist tell you to go to a chiropractor, your primary? If I was in Vegas, I would bet no. We're seeing a little bit more of it nowadays. I was shocked when this patient told me that their neurologist told them to see a chiropractor. I was pleasantly shocked, I should say, pleasantly excited, pleasantly happy, because I see a change occurring. Finally, they're asking a chiropractor to see if the chiropractor can help instead of telling them. So maybe that neurologist, wherever they are, watches my podcast and heard me speak and said, you know what, you should probably go ask a chiropractor that can help you. Actually, this neurologist recommended a chiropractor, which I think is amazing. So if you're having some pain or tingling or irritation in your arm, what we call radiculitis, or your shoulder, that could be coming from your neck, a chiropractor is a great place to start. If you pass your exam findings and your neck x-ray looks good, then the chiropractor can refer you where you need to go. If you don't pass your neck exam, you don't pass your neck x-rays, and the chiropractor is a great place to start your care to make the other care that you get after that point more successful. So if you're having any kind of radiculitis coming from your neck, you should definitely see a chiropractor. So there you have it. Can chiropractor help with radiculitis? Chiropractors have helped with radiculitis since 1895, so definitely see a chiropractor first. And remember, if you have a question about chiropractic or chiropractic care, you should always ask a chiropractor, because only a chiropractor studies chiropractic. Next, I'm going to set up a meeting here in town to start working with some primary doctors in my own community, because I'm trying to find a primary doctor to send my patients to. A lot of times I want to make sure I send them to a primary that understands what chiropractic is, so they can work with the patients better, and bottom line is the patient wins, right? The doctor understands chiropractic, the chiropractor understands the role the doctor's doing, communications between our offices open up, they coexist, and the patient gets the best care possible in both worlds. So there you have it. Ask the chiropractor. Now, if you have a question about chiropractic or chiropractic care and you'd like to know the answer, or you'd like to ask a chiropractor, leave me a message wherever you're listening to this or hearing this or seeing this, And I'll get that message, I promise you. And I'll get back to you with your answer. Otherwise, you can always go to my website. Those links all over wherever you're listening or watching this. All right, everybody, thanks for tuning in. Come back next week for another question for Ask the Chiropractor. Thank you.